Caring for patients can be tremendously satisfying, offering a sense of meaning, purpose, and difference making incomparable to that which may be found in any other field, yet it can incur at the cost of caring, commonly known as compassion fatigue. Within the high care professions, where empathy, compassion, and caring for others are at the core of practice, compassion fatigue is recognized as an occupational hazard. Almost everyone who cares for others in the high care professions will eventually experience some degree of compassion fatigue. Compassion fatigue, which is a combination of physical, emotional, and spiritual depletion associated with caring for patients in significant emotional pain and physical distress, is associated with the display of negative emotional outcomes such as anger, frustration, anxiety, and feelings of helplessness. Researchers have suggested that these negative emotions may be exacerbated due to job strain and an unsupportive work environment. Studies have shown evidence that occupational stress leads to structural and functional changes in the brain. Series of PET scans and MRI studies of several independent cohorts found compassion fatigue to be associated with specific changes in the brain. We will look at the effects of occupational stress on individuals in medical settings and how it affects one's brain structure and function, as well as techniques used to treat such conditions. This particular topic impacts myself, this speaker, directly due to experiences and signs and symptoms of compassion fatigue in the recent past. Working in a nursing home type of setting, caring for geriatric population during pandemic while dealing with death, observing patients suffering, coping with demands of patients' frantic families while they were unable to visit their loved ones in person, making ethical decisions, critical and quick life-saving decisions, adjusting and enduring long working hours and night shifts, adapting to understaffing. All of that resulted in feelings of physical and emotional exhaustion, depletion of energy, impaired attention and memory, impaired verbal memory function, depression, and even depersonalization. Many nurses, including the speaker, have developed maladaptive coping mechanism in the form of underestimating the significance of occupational load, accepting high workload, feeling that the work situation can be controlled by increasing working hours. Nurses are in the center of all that we do, and empathy, compassion, and caring for others are at the core of what we do. Yet, the ability to work in a compassionate manner can wane. Almost everyone who cares for others in the practice of medicine will experience, to some degree, compassion fatigue. The consequences cannot be underestimated. The more we learn about this unavoidable occupational hazard, the better for ourselves, our patients, our clients, and our practices. Basically, compassion fatigue can deprive nurses from the very reason why they chose to be of service, affecting physical, emotional, and psychological well-being. Yet, through effective leadership and emotional intelligence, one can alleviate the symptoms and return to a more self-aware and more compassionate being. While the caring and compassionate connections established between nurses and patients can be deeply rewarding, the increasing complexity in healthcare, along with the intense human interactions required of nurses, often leads to high levels of stress. It manifests in physical symptoms, which includes headaches, digestive issues, muscle tension, sleep disturbances, fatigue, and even cardiac symptoms. Emotional symptoms include mood swings, poor concentration, focus and judgment, restlessness and anxiety, excessive use of mind-altering substances, irritability, anger, resentment, oversensitivity, depression, and loss of objectivity. Work-related symptoms can manifest as lack of joyfulness, frequent utilization of sick days, avoidance or dread of working with certain patients, reduced ability to feel empathy towards patients and families. Compassion activates areas of the brain linked to reward and affiliation and generates positive emotions towards suffering, all of which motivate, not hinder, helping behavior. Compassion may even thus be viewed as an emotion regulation strategy that buffers or counteracts the negative emotions through the generation of positive emotion. Avoidance of painful emotions is often the motivating force in negative behaviors, such as substance abuse, binge eating, suicide. These actions are part of maladaptive approaches to control, avoid, or regulate painful emotions. Furthermore, In a study in which the subjects experienced 4 weeks of both high and then low stress, the experiencing of high psychosocial stress was found to negatively impact prefrontal cortex, which regulates our thoughts, actions, and emotions, such as communication, emotional balance, fear modulation, empathy, moral awareness, insight, and bodily regulations. Thankfully, it was found these effects were reversed in subjects after a period of low stress. Another component that plays a big role is effective leadership in a work environment. Leadership is critical to create positive experience and situation in all areas of our life, whether at home, work, or with colleagues or friends. It involves action, creativity, motivation, and visioning. If leadership can acknowledge, empathize, and address nurses' concern, the nurse feels valued. By encouragement to openly share their concerns regarding compassion fatigue, leaders can go at it to resolve them. Support, emotional intelligence has been widely used and can contribute to return to one's state of well-being. As nurses begin meeting the needs of others, they often neglect the needs of their own. It is important to recognize, identify, and strategize to replenish and promote physical, emotional, and spiritual well-being. Developing positive self-care strategies and rituals are essential. Activities that one participates on a regular basis that replenishes personal energy levels and enhances feelings of well-being. A commitment to proper care for oneself includes good nutrition, hydration, sleep, and exercise. Relaxation techniques such as yoga, meditation, tai chi, or massage have been found to be very beneficial. In conclusion, compassion fatigue is a struggle that many nurses and medical professionals continue to deal with currently, if not more, in comparison to recent past. The fact that there is evidence of occupational stress leading to structural and functional changes in the brain, as supported by studies, resulting in depressive disorders, makes this condition even more concerning. Incorporating healthy work balance, social interactions, support from peers and management as part of good leadership, mixed with self-compassion, are just a few tools one can use.